Hello everyone, today we will be discussing about the ophthalmic artery, its origin, course and branches. So starting with its origin, it originates from the cerebral part of internal carotid artery, the third part of the internal carotid artery, actually just medial to the anterior clinoid process, and as it originates along with the optic nerve, it enters the orbit through the optic canal. Now, as it enters the orbit, it crosses the optic nerve from above and then travels medially along the medial border of the orbit wall and finally terminates by giving two branches, the dorsal nasal artery and the supratrochlear artery. Okay, so this is the course. The you can say grossly I have told there are many relations, like it is related to superior oblique and lateral rectus while going through the medial wall of the orbit. So let's go further into its uh, branches, which are the main thing we are going to discuss. So the two terminal branches which we have already included are dorsal nasal artery and supratrochlear artery. The next and the very important branch is central retinal artery. So this may be little fade, so let's zoom it here. The central retinal artery, as it arises from the main ophthalmic artery, lies below the optic nerve and uh, around 1.2 centimeter uh, behind the root of the optic nerve. It pierces the dura sheath of the optic nerve and then travels forward within the substance of optic nerve and then arises, as we see in the fundoscopy, as optic disc, giving off four branches as they appear like this, including the supratemporal, infratemporal, the superior nasal and inferior nasal. So after this completes the central retinal artery. The next branches and the main branch is lacrimal artery. So the lacrimal artery, as it is given, it travels along the lateral border of the orbital wall, sorry, and then it gives off a terminal branch, the lateral palpebral branch. Now this lateral palpebral branch, along with the branch medial palpebral branch, which is given by the main ophthalmic artery itself, combines and form an arcade within the eyelid, and this is going to supply the eyelid, the medial palpebral and lateral palpebral branch. The other branches from lacrimal artery include the zygomatic branch. Now the zygomatic branch through the foraminars in the lateral wall of the orbit comes out and gives two arteries, the zygomaticofacial artery, which comes out through zygomaticofacial foramen, and zygomaticotemporal artery, which comes out through zygomaticotemporal foramen. And the third type of branches from the lacrimal artery are muscular branches. Now these are very important because these gives off anterior ciliary artery, which forms uh, arterial arcade, the major arterial arcade within the iris, along with a contribution from long posterior ciliary artery, which we will be discussing soon. So till now, let's revise. We have studied about the main ophthalmic artery giving off two terminal branches, the dorsal nasal and the supratrochlear, the central retinal artery, the lacrimal artery, which gives off three type of branches, the lateral palpebral, the zygomatic branch and the muscular branches, which contribute in the formation of major arterial arcade. Now the other branches constituting this major arterial arcade are the posterior ciliary artery. But wait, the posterior ciliary arteries are of two types. The long posterior ciliary arteries, the one shown with another color, if is it visible, the pink one. These are the arteries which travel between the sclera and the choroid to reach till the iris and contribute in major arterial arcade, whereas another posterior ciliary arteries are the short one. As the name suggests, short posterior ciliary artery, they never reach and they never form the arcade. They just supply the eyeball posterior to the equator. Now the other type of arteries are direct muscular branches from the ophthalmic artery. So these are the arteries, the main arteries. And another one, the important one, are the posterior ethmoidal and the anterior ethmoidal arteries. Now the posterior ethmoidal arteries, they travel through the foramina in the medial wall of the orbit, and while passing through the cribriform plate, they give off two type of branches. Now this one is important. They give off the meningeal branches that remain in the cranial cavity, and another one is a septal branch. Now these one are going to supply our nasal septum, and anterior ethmoidal similarly gives off a meningeal branch and a nasal branch. Now the important thing, let's say a very important thing, is the anterior ethmoidal artery is a part of Kieselberg plexus or the Little's area, but posterior ethmoidal artery is the one which although supplies the nasal septum but do not constitute a part of Little's area. So these are the main branches. Let's revise it quickly. The internal carotid artery giving off the main ophthalmic artery, terminal branches dorsal, nasal and supratrochlear artery, the lacrimal artery giving off three branches, zygomatic, muscular and the lateral palpebral, medial palpebral directly from ophthalmic. We have the direct muscular branches from the ophthalmic, the central retinal artery, the posterior ciliary artery, the long one and the short one, and the anterior ethmoidal and the posterior ethmoidal artery. Oh, one more which we left was superior orbital artery. Thank you.